أهلا بكم في هذه المقابلة الخاصة.
Welcome to this special interview. At a critical moment in human history, the spread of coronavirus after its emergence in China created a state of anxiety, confusion, and fear of the unknown across the world. Amid this turmoil, there was a voice that had the ability to communicate with people and guide them, as he provided updates and advice on various aspects, ranging from hygiene practices and social distancing to government lockdowns, school closures, hospitalization rates, and finally, vaccines. Some view him as a hero deserving of honor, while others see a villain worthy of blame. Dr. Anthony Fauci, former director of the National Institute of Allergy and Infectious Diseases and former chief medical advisor to the U.S. President, joins us in this episode to discuss his journey and his recently published memoir, On Call, A Doctor's Journey in Public Service. Dr. Fauci, welcome to this special interview, and thank you for your time. Allow me to begin with asking about something that attracted my attention while reading your memoir. The U.S. military enlisted your help in Iraq after 2003. What was the nature of the mission assigned to you in Iraq?
ما هي طبيعة المهمة التي أوكلت إليك في العراق دكتور فاوتشي؟
We were going there to see if we could help out with the medical facilities in the hospitals there, as well as to see if we could begin some collaborations with Iraqi physicians so that we could have better relationships, that we could use medical collaboration as a vehicle to increase and make better collaborations with the Iraqis. So it was a mission of mercy, number one, to see if we could help out with the hospitals, but also to see if we could collaborate on medical issues.
Let's move on to the most exciting period in your career, the COVID-19 pandemic. According to your memoirs, you initially dismissed the call for mask wearing, then reversed your stance in March 2020. Was there scientific evidence based on data that prompted you to change your views at the time?
Yes, there was. The information that we had in January was one that made us lean towards not requiring masks. One, it was felt that masks were in short supply, and we didn't want to take it away from the healthcare providers who needed them, since they were taking care of sick people. Number two, we did not have any information at the time that masks were effective outside of the setting of a hospital. And third, we were unaware at the time that more than 50% of the transmissions were from people who had no symptoms at all. So that made us lean towards not recommending masks. But very soon, literally within a month or so, it became clear that there was not a shortage of masks, that there were plenty of masks for healthcare providers and for the general public. Number two, it became clear that masks did protect you, even if you were not in a hospital setting, namely if you were just going about your daily life. And third, we became very aware that the virus was transmitted very efficiently from people who had no symptoms. When we realized that, we quickly changed the recommendation that people should wear a mask indoors.
But Dr. Fauci, you admitted before a House committee that measures such as social distancing were not scientifically backed. So, during this phase when COVID-19 spread, how were safety measures set? What data were you specifically relying on?
Yes, there was some solid data based on the premise that the virus is spread by respiratory droplets. So the Centers for Disease Control, not me, but the Centers for Disease Control, which is another agency of the United States government, made a recommendation that there should be 6 feet of distance in schools and in factories, because if you assume that the virus is spread by droplets, that those droplets would fall to the ground within 6 feet of emanating from your mouth or your nose. That was the scientific basis for the 6-foot rule. However, as the months and years went by and further studies were done, it became clear that the virus was spread not only by droplets, but by aerosol, which means that the virus could float in the air for reasonably long distances, which means that rather than having an arbitrary distance, we should be increasing our ventilation and increasing the capability of getting airflow to prevent people from breathing in the virus. So it was an accumulation of knowledge that took place over a period of months to a year or more. But the original basis for the 6-foot rule was the assumption that droplets was the only way that the virus was spread, which turned out to be incorrect.
هنا كلمة يجب أن نتوقف عندها كلمة
You mentioned assumptions in your statements. It seems that many of these measures were not backed by scientific data, but they were rather just different ideas. If so, why did you oppose former President Donald Trump's advocacy for the use of hydroxychloroquine in treating COVID-19 even though the drug was effective for many people?
علما بأن هذا الدواء أثبت فعالية مع الكثير من الأشخاص حول العالم.
It is, you are entirely incorrect, sir. There are many studies that show that hydroxychloroquine is not effective in COVID, and it can harm people. There was a study showing there was a large number of deaths in people who had adverse events from the drug. But one thing is very clear, that clinical studies show that hydroxychloroquine has no beneficial effect for COVID. That's the reason why I pushed back on President Trump when he was incorrectly saying that hydroxychloroquine was a cure-all for COVID, because that was not correct, and it was disproven by good scientific studies.
Dr. Fauci,
The memoirs clearly outline your stance on Senator Rand Paul's accusations regarding the National Institutes of Health's funding of research at the Wuhan Institute, where it's believed the virus leaked from. Given you have over 40 years of experience in virology, where do you believe the coronavirus originated from? This question remains unanswered. Is it a man-made or a natural virus?
من أين جاء فيروس كورونا وهل نحن أمام فيروس مخلق أم فيروس طبيعي؟
We don't know definitively what the origin of COVID and SARS-CoV-2 is. However, there's one of two possibilities, either a lab leak or a natural occurrence of jumping from an animal reservoir to a human as a natural spillover. If you look at the available data, although it is not definitive, there's very good data agreed upon by a wide range of evolutionary virologists from all over the world, from Australia, the UK, Canada, the European Union, and the United States, that data show and strongly suggest, even though it isn't definitive, strongly suggest that it was a natural spillover from an animal reservoir. On the other hand, there is no data at all to indicate that it's a lab leak. So although I keep an open mind because there's no definitive conclusion, the data are very strongly weighted towards it being a natural occurrence.
There's another question related to the location of such viruses. Why do these viruses often originate from regions like Southeast Asia?
Well, it isn't always, but it is very frequent, and that is because of the consistency of the animal-human interface, where humans come into contact, very intimate contact on farms or in markets, for example, with chickens that have H5N1 influenza. Since there's a phenomenally large chicken industry in Southeast Asia and in the Far East, it is much more likely that there will be spillover of viruses in that part, in that region of the world. Also, the wet markets that we see in Southeast Asia, China, and the Far East indicate that humans are put into close proximity of animals that have the possibility of harboring viruses that could infect men. We know that historically. If you look over decades and decades, 75% of all of the new infections in man are zoonotic, which means they jump from an animal reservoir to a human. And we've seen that consistently over the years.
دكتور فاوتشي يعني خلال
Dr. Fauci, in your memoirs, you frequently cite Italy and the extent of the virus outbreak there, and criticize the lack of compliance with social distancing and isolation measures. However, there were other countries like Sweden that strictly adhered to these measures, and the virus continued to spread. Why do you think this happened?
ولم يتوقف أيضا تعداد الضحايا. لماذا برأيك؟
Well, in Sweden, they were much more cavalier in not having social distancing. And that's the reason why they did much more poorly than the other Scandinavian countries. So Sweden is a good example. When you don't social distance, you get a very large increase in infections. And that's what happened in Sweden.
Sweden did not comply with social distancing. The country was in lockdown for months, Dr. Fauci.
Yeah, but they opened up very, very clearly more than other countries. So if you look at the history of what Sweden did, they opened up and did not lock down much at all and just let people go about their business. And at the end of the day, they had more infections and hospitalizations than other Scandinavian countries.
طيب دكتور فاوتشي وفاة والدتك
Your mother's death from liver cancer had a profound impact on you, as you mentioned in your memoirs. But weren't you affected by the thousands of patients who died in nursing homes in New York due to the measures that you advocated and that were adopted by the New York state government because there were no hospital beds available? Who is responsible for the death of people during that period?
مسؤولية من دكتور فاوتشي؟
Well, I think you have something that's dramatically incorrect. I did not and had nothing to do with the recommendation of getting people who are elderly in a hospital and moving them to a nursing home. So I don't know where you got that information, but it is dramatically incorrect. I had nothing to do with the policy of moving elderly people from the hospitals to the nursing home. So you should go back and check your sources because they are incorrect.
لا أقول أن لك علاقة بنقل المسنين دكتور فاوتشي.
I'm not saying you had anything to do with the transfer of the elderly, but at the time, you were speaking on behalf of the federal government. The New York state government took measures based on the recommendations of the federal government. Hospitals were overcrowded, so the state government had no choice but to send patients to nursing homes.
تجد حكومة الولاية أي مكان سوى دار المسنين.
Yeah, and what's your question? Because I was not involved in those policies. So I'm not sure why you're asking me that question.
من كان يضع هذه
Who was
السياسات؟
setting these policies? You weren't just addressing the American people. You were addressing the entire world during this period. Whether beside former President Donald Trump or even afterward, you continued to do so with the current president, Joe Biden.
Yeah, but what was I telling the world? I was telling them to get vaccinated, to wear a mask, and to do social distancing. That's what I was telling them. You should go back over the clips and get your data correct.
دكتور فاوتشي كمدير المعهد الوطني للحساسية.
As the director of the National Institute of Allergy and Infectious Diseases, you handled public policy toward diseases like AIDS, bird flu, and swine flu. Were the methodologies used in producing vaccines for these diseases also applied in the development of the COVID-19 vaccine?
No, I think the COVID-19 vaccine was a major success story for basic and clinical research. We at the NIH, the institute that I directed for almost 40 years, had made decades of investment in basic and clinical biomedical research in order to put us in a position that when we needed a vaccine for a deadly disease like COVID, we were able to do something that was completely unprecedented in the history of vaccinology. The virus and the sequence of the virus was made known on the 10th of January of 2020. Within 5 days of that, we began work on a vaccine, and less than 11 months later, in collaboration with the pharmaceutical companies, we had tested the vaccine in tens of thousands of people, and in less than 11 months, we had a vaccine that was safe and highly, highly effective to the tune of more than 90%. So we were very fortunate in that we were able to get a vaccine in absolutely record time for COVID. And that is a testimony to the importance of basic and clinical research investment.
لقاح آمن وقصة نجاح، لكن يبدو أنه
The vaccine is safe and a success story, but it doesn't seem to reflect reality on the ground. Many people around the world talk about the side effects of the COVID-19 vaccine, and even the companies themselves have admitted there are side effects. In your opinion, who is responsible for the harm that many people suffered from as a result of the vaccine? Just a few days ago, the Centers for Disease Control and Prevention reported that more than 112,000 cases had an increased risk of stroke due to the COVID-19 vaccine, which you claim is safe and a success story.
بسبب لقاح كورونا الذي تقول أنت أنه آمن وأنه قصة نجاح.
No intervention is 100% safe. When I say safe, you're talking about the risk-benefit ratio of an intervention. In this case, the intervention is a vaccine. There is no doubt whatever, that the vaccines for COVID have saved millions and millions of lives throughout the world. No doubt about that. Are there some adverse events that occur? That is true, and that's unfortunate. But when you balance the benefit of saving millions and millions of lives that would have been lost with the rare adverse events, and they are rare, they occur, but they are rare.
على ذكر الفوائد دكتور فاوتشي.
Speaking of benefits, Dr. Fauci, there's a question you didn't answer in your memoirs or before Congress. How much did the National Institute of Allergy and Infectious Diseases receive from Pfizer and Moderna in royalties for the COVID-19 vaccine?
المشاركة في حقوق الملكية لإنتاج لقاح كورونا.
There is a law in the United States that says that when the federal government scientists work to develop a product, they are required to take out a patent. Those patents have with them a royalty that has a limit on it. So each individual scientist cannot get any more, if they were the inventor of a patent, any more than $150,000. But let's talk about me. I got no royalties from vaccines, zero. So when people were talking about royalties and Senator Paul was talking about royalties, he was implying that I got royalties from vaccines. That is completely incorrect. And there are records to prove that.
طيب دكتور فاوتشي في 2020 كانت هناك
In 2020, specifically after your comments about booster doses, there was a quarrel between you and former President Donald Trump during a phone call. What exactly happened during that call?
ما الذي حدث تحديدا خلال هذه المكالمة؟
Well, I described it in the book. He was upset because I had said that we likely would need booster shots because the durability of protection would not be indefinite. And he wanted so much to be able to say that the vaccine were going to solve all the problems because the election was coming up, that he got angry with me for telling the truth. And the truth is that the vaccine protection does not last for an indefinite period of time. You have to follow up with boosters to maintain the level of protection.
على ذكر يعني علاقتك مع الرئيس السابق دونالد ترامب.
Speaking of your relationship with former President Donald Trump, he accused you of costing the American economy $1 trillion due to the measures you advocated, such as lockdowns and repeated calls for booster shots. Many people around the world lost their jobs due to these measures, which later turned out not to be as effective as initially thought. Do you feel you owe those who lost their jobs and livelihoods because of these measures an apology?
اعتذار لهؤلاء الذين فقدوا وظائفهم وفقدوا أعمالهم بسبب هذه الإجراءات؟
No. I'm very sorry. You're being very antagonistic on this interview, which is really unfortunate. I didn't think it was going to turn out like this. I, in good faith, uh, agreed to have an interview with you, but you're very accusatory in your manner towards me, which is not appreciated. First of all, I did not lock down anything. The coronavirus task force, which is chaired by Dr. Deb Birx, who reports to the Vice President of the United States, who reports to the President. That's how we had the social distancing. And as a matter of fact, you're incorrect. Even though there were negative effects on jobs and on schools, we know that. That's unfortunate. But many lives were saved because of that. So it depends on the perspective that you're taking. If you're looking at the lives that were saved at the time that the United States had the social distancing and the 15-day flattening the curve, we were having 3,000 to 5,000 deaths per day in the United States. We needed to do something that was very dramatic to stop that. And that was the reason for that. But it wasn't my decision to do that. It was a decision of a task force that was led by the vice president.
طيب يعني دكتور فاوتشي أرجو أن لا تعتبر الأمور شخصية.
Dr. Fauci, please don't take this personally. You stood your ground against former President Donald Trump's outbursts, as you mentioned in your memoirs. This isn't an attack. These are questions being asked in the Middle East and across the world. Your presence with us today is an opportunity to clarify matters. Speaking of criticism, you criticized Dr. Scott Atlas, who consistently advocated herd immunity. It seems that herd immunity played a significant role and proved effective after 2 years. What do you think of herd immunity in terms of combating the coronavirus?
دور مناعة القطيع في التصدي لفيروس كورونا دكتور فاوتشي.
Herd immunity is entirely ineffective when it comes to COVID. That has been proven for absolutely certain. In herd immunity, if you get infected, you are protected against subsequent infection. If you get vaccinated, you are protected against subsequent infection. COVID is a depressing example of why Scott Atlas is completely incorrect in that COVID does not provide herd immunity. Let me explain. I have been vaccinated 5 times. I've gotten infected 3 times. In fact, as I'm speaking to you now, I'm infected with COVID. So to say that a herd immunity exists in COVID, I'm living proof that it doesn't.
هذا يعني برأيك بأنه اللقاح هو الذي لعب الدور الكبير.
So, in your opinion, it's the vaccine that played the significant role. So how do you think the pandemic ended? You say you are indeed infected, but there is no longer any talk about the coronavirus. After all these years, we still don't know how the coronavirus started. So, how did it end?
Well, we still have an increase in cases now in the United States. If you follow the news, which I'm sure you do, you'll see that there's an increase in cases in the United States and even some increase in hospitalizations. The reason it isn't as bad as it was in 2020, 2021, and in some respects in 2022 is because most people have been infected and or vaccinated. Now, getting back to herd immunity, which doesn't exist very well, it doesn't protect you against getting reinfected. I'm an example of that. I've just recently got infected, even though I was infected 2 previous times and got vaccinated 5 or 6 times. What it does protect you against is getting severe disease. So if you've been previously infected or vaccinated, even though it isn't very good at protecting you against getting infected, it does have a very favorable effect on protecting you against hospitalization and death.
دكتور فاوتشي هناك من اتهمك
Dr. Fauci, some have accused you of doing what you deemed as politically appropriate instead of following science. Some point to the fact that you changed your assessment of the virus's severity just one day after the election that President Joe Biden won. Did that actually happen?
جو بايدن هل حدث ذلك بالفعل؟
I don't know. What was your question? I'm sorry. There you go with the accusatory stuff. What was your question?
والله هذه ليست اتهامات.
These are not accusations, Dr. Fauci. This is specifically what Dr. Scott Atlas said. He claimed you did what you deemed as politically appropriate rather than following science, and that you changed your assessment of the pandemic one day after Joe Biden won the election.
التي فاز فيها بايدن.
That is incorrect. There is absolutely no evidence that that is the case. Scott Atlas has been discredited in the United States. So I don't know of anybody that listens to what he says now.
هناك بعض الناس
Some believe your relationship with former President Donald Trump was not good, while many have noticed that you have a good relationship with President Biden. Why do you think that is?
لماذا برأيك دكتور فاوتشي؟
I had a very good relationship with President Trump in the first few months. It was only when he was realizing that the virus was not going to disappear, and I had to say, it is not going to disappear. And then when he started saying hydroxychloroquine was going to be the cure, and I had to say it's not the cure because science proved that it's not the cure. That's when our relationship turned a bit sour. But in the first few months of his presidency, I had a very good relationship with President Trump.
دكتور فاوتشي أنت عملت مع 7 رؤساء أمريكيين. تعلم
You
جيداً
worked with
بأن
7
هذا
U.S. presidents. You know very well that this position requires physical and mental capabilities. Do you think the current candidates have these capabilities?
على الساحة في الولايات المتحدة؟
No, I can't comment on that. That's not appropriate for me to comment. You'll have to ask their physicians.
هل ترى
You said it is inappropriate to judge President Biden or assess his mental state based on a debate that only spanned 90 minutes. Do you think the current president is still in good health?
My experience with him has been that he is in good health, but that was over a year ago. So I would have to refer your question to people who deal with him on a daily basis now. When I was in the White House, he was fine. He was sharp. He asked good questions. He probed and had good conversations. But that was a year ago. So I really can't comment on anything more recent because I haven't interacted with him.
Thank you, Dr. Anthony Fauci. Dear viewers, this concludes our interview with Dr. Anthony Fauci, the former director of the National Institute of Allergy and Infectious Diseases and the former chief medical advisor to the U.S. President. Goodbye.